On Larry King Now, we're looking at the state of HIV/AIDS in America.
The number one reason that most people do not tell people that they have HIV is because they do not know it.
The communities being hardest hit by the virus.
The gay, the LGBT community, particularly the transgender community, injecting drug users. I mean, these are populations that I think the HIV has added to the stigma that they've been experiencing.
And then you add color to that.
Absolutely.
Then you add things like poverty to that. Then you add lack to that, lack of education, lack of access. It makes it even worse.
How close are we to a cure? What percentage of people with HIV get AIDS?
It could be 0% if people went on treatment.
If every person who got HIV went on treatment, no one would get AIDS?
Right. We have the tools to end AIDS, not just in America, but around the world.
Has the fight to end the epidemic lost its steam?
We've been facing HIV/AIDS for 30-plus years. We've had incredible success in the matter.
Your success has led to a complacent attitude.
Success has led to a complacent
And is that a deserved attitude?
No, it's there's still a lot that needs to be done.
All next on Larry King Now. Welcome to Larry King Now. In 1987, 68% of Americans named HIV/AIDS as the most urgent health problem facing the nation. In 2012, it was 10%. In today's special episode, we're taking a look at the state of HIV/AIDS in America, how far we've come in the fight against the virus, the dangerous stigma and misconceptions that still prevail, and why, when 1.2 million people live with HIV in this country, ending the epidemic has fallen so low on our national priority list. Joining us today is Jake Glaser. He is co-founder of Modern Advocate and a spokesman for the Elizabeth Glaser Pediatric AIDS Foundation, created by his late mother after losing Jake's sister to HIV/AIDS. Jake contracted HIV in utero and is a healthy HIV-positive adult. Dr. Judith Currier is chief of the UCLA Division of Infectious Diseases and associate director of the UCLA Center for Clinical and Research and Education, or CARE. Christopher Brown is director of Health and Mental Services for the Los Angeles LGBT Center. He's been living with HIV since 1983. And Cheryl Lee Ralph is the Tony-nominated performer and activist who founded the Diva Foundation, which stands for Divinely Inspired, Victoriously Aware, to honor the friends she's lost to HIV/AIDS. Jake, you're 30 now. You've been living with it all your life, right?
Yes.
Born with it.
Born with it.
Never gotten AIDS.
Nope.
Right? How do they treat you? How is the HIV person without AIDS treated?
I'm treated by a very dedicated community of HIV/AIDS physicians. I've had an incredible support group around my family and my own care for most of my life. Interestingly enough, my father does carry a very rare genetic modification, a genetic defect, that has helped keep me very healthy in my life.
His defect?
Yes. So it's been a combination of some luck and some care and treatment.
What age did they tell you what you would face in your life?
You know, I'd always known about it from a young age. I didn't fully grasp the call to action and the understanding along with the community that I'm a part of, believe it or not, until I was about 27 years old.
Cheryl, why are you involved in this?
You know, for me, it all started on Broadway. I'll never forget that I was in the middle of the best and the worst of all times, because there I was starring on Broadway in Dreamgirls, and I'm telling you, life didn't get much better than that. But then at the same time, that curtain would come down and your friends were getting sick and they were just dying. It was the idea of being able to see him sit here looking so handsome and strong and being described as a healthy HIV positive person. We didn't know what that was because we saw hell. Your friends got sick. They got those strange purple Kaposi spots on their bodies. They lost weight. If they were black, they became black, and their skin at times would shed. And it was horrific to see how people treated your friends as if they were not loving children of God, as if they had not been somebody's friend, somebody's lover, somebody's child. And I saw, as a church kid, the worst come out in people, and that's why I got involved.
Dr. Currier, by definition, what is HIV?
HIV is a virus, and it causes the disease AIDS when it impairs the immune system. It has the ability to attack the immune system, and that's what makes it so powerful.
What does it stand for?
Human immunodeficiency virus.
What percentage of people with HIV get AIDS?
Well, that depends. It could be 0% if people went on treatment and were in care.
If every person who got HIV went on treatment, no one would get AIDS?
Right, right. That's why people say we have the ability to end AIDS in our lifetime, because we have the tools to end AIDS, not just in America, but around the world.
When a person has HIV and being treated, what problems do they have? Do they have fevers? Do they get anything?
So you can be diagnosed with HIV infection and have no symptoms and go in and start on treatment, take the treatment, respond to it, and never have any symptoms. Or you can have, if you wait a long time and you have HIV, then your immune system is attacked, and then you have all the consequences of that with different types of diseases and symptoms. So it really depends on how, what you have access to and what you do about it.
How are you?
Brilliant disease, because it has a way of hiding. It learns, it'll be dormant, it'll watch what's going on, then it can hide itself from what you bring at it the next time.
You've had it for?
I was infected in 1983. It was a big turning point in my life. It was actually at the same time that I started my career in public health and started working in the STD, sexually transmitted disease field, which rapidly evolved into the HIV field. I'm a gay man, and I can remember in about the mid-1980s, about 1985, when I found out I was HIV infected, and starting my career in public health, I just realized I'm at the right place at the right time. This is exactly what I need to be doing. And I feel like I've been personally motivated and professionally motivated for the last 30 years.
About the same time as Magic Johnson, who became the most
he
famous
shortly
case
afterwards,
of
yes.
HIV in America.
I think it was 87, right.
And he never got AIDS.
Right, right.
Can you say you are free of AIDS? You will never get AIDS.
So I don't have AIDS, I have HIV.
I know,
And,
but you will never get AIDS?
Yeah, my viral load is undetectable. My immune system's in really good shape. So the chances of me progressing to AIDS are probably quite slim.
We're discussing the state of HIV and AIDS in America. Coming up, we'll talk about the drugs that have helped transform HIV from a death sentence to a manageable condition. Stay with us. We're back with our terrific panel. Jake, why is HIV now 10% of the population considers it a health problem?
I think a lot of it is some of it is the news that we put in the world. Some of it is the general dialogue and educational behavior that we have around an issue like this. We've been facing HIV/AIDS for 30 plus years. It's a long road. There's been a lot of hurdles we've had to overcome. We've had incredible success in the matter.
So your success has led to a complacent attitude.
Success has led to a complacent attitude.
And is that a deserved attitude based on all you're telling us? We've got drugs, we treat it.
No, it's there's still a lot that needs to be done. I mean, if you think about it, 600 newly infected babies every single day.
HIV. How many new AIDS patients every day?
That's...
Doctor?
Yeah.
That's a harder number to estimate, but still, millions of people die every year.
The stigma has diminished too, hasn't it?
Yeah.
No?
No.
I would say the stigma has grown in a lot of respect. There's, with lack of educating and a lack of a general understanding that this is a part of our daily dialogue, whether it's in school and sex education or the information we're putting into the news. For the history of this issue, it has been a fear-based stigma. People have been afraid of HIV and AIDS, and it's been stigmatized in a lot of different ways, from intravenous drug users to the homosexual community. And at the end of the day, I don't think that fear has gone away. That's right. And so when we put terms out into the world like we found a functional cure, or we celebrate these moments...
You're the one that puts it out. We see you. You were born with it.
Yep.
We look at you. We look at you. Hey, so people don't fear HIV patients anymore. If a person comes in now and says, I have HIV, I've had it for 20 years, big deal. They treat you nice, right?
But
they treat you well. I mean,
but I think
Depends.
HIV's hit hard populations that have been experiencing discrimination for many, many
That's
years.
right.
You know, the gay, the LGBT community, particularly the transgender community, injecting drug users. I mean, these are populations that I think the HIV has added to the stigma that they've been experiencing. We're still seeing significant discrimination and stigma with transgender people living with HIV.
And then you add color to that.
Absolutely.
Then you add things like poverty to that. Then you add lack to that. Lack of education, lack of access to health care. It makes it even worse. The number one reason that most people do not tell people that they have HIV is because they do not know it. And as long as they do not know it, it keeps the disease out there with its strong ability to spread. It wants lack. It wants to be stigmatized. It wants to be marginalized. It wants you to not like it.
I mean, the other way that stigma plays in is that people will be tested, but they still won't access services because
Why not?
Because they don't want anyone to know they have HIV. They don't want anyone to know.
Are we ever going to cure HIV?
You know, I hope so. We're sure going to try.
What will it take?
Well, it takes an investment, and our government and NIH has invested into this as an area of research. It takes brave people living with HIV to step forward and participate in some of these new studies, and you know, it takes a ability to, you know, have organized research around this and funding for it.
All right, now the World Health Organization recently released new recommendations that anyone with HIV diagnosis should begin taking antiretroviral medication as soon as possible. Yes. Why hasn't this always been the case?
So the main reason this hasn't always been the case is that early on the treatments that we had were associated with toxicities and were more complicated to take. And so the question was, when is the optimal time to begin taking treatment to get the maximal benefit with the least amount of risk? Now that our treatments are easier to take, better tolerated, and safer, there's no reason not to treat someone.
At the Los Angeles LGBT Center, we are putting great efforts into testing individuals, trying to find the approximately 14% of people that are living with HIV that don't yet know it, and then immediately linking them into care and getting them on treatment.
Are the antiretroviral drugs affordable?
Ooh, no, they're not. They're not affordable. And I think that's with the work that the Elizabeth Glaser Pediatric AIDS Foundation does, for example, in Africa, compared to the access to treatment that a community of HIV-positive individuals are, experience here in the U.S. That the access is give and take, and I'd say there's probably better access in the United States, but the cost is extremely high.
Extremely high, which goes to who gets treatment and who doesn't sometimes.
Your husband is a Pennsylvania state senator, right?
Yes, he is.
Vincent Hughes, and he worked to provide health services to the uninsured. How's that doing?
It's doing very well. But with my husband and myself, we created Test Together, where we encourage people to come together, get tested together. Mothers, take your daughters. Fathers, take your sons. Talk to your children in an age-appropriate way so that they can keep themselves safe. We have been able to partner with the at-home test kit to spread it throughout the South to people who do not have access to testing. And this is what we have to do, because it depends on who's going to spend money on your care. Or are you better off just dying?
Will you come back one day and talk about your career?
Absolutely.
It's so hard to draw you out. So. Thanks to Cheryl Lee Ralph for joining us. Her foundation, Diva, boasts the longest consecutive running musical AIDS benefit in the country. We'll now be joined after the break by the Advocate Editor-at-Large, Diane Anderson Menschell. After the break, she'll discuss HIV transmission among women and how many people living with HIV in America don't know they're infected. We'll be right back. Our outstanding panel now joined by Diane Anderson Menschell. Diane is editor-at-large for The Advocate and editor-in-chief of PLUS, the most widely read magazine for people living with HIV. Why is it called PLUS?
Because it used to be called HIV Plus, actually, and one of the reasons we took HIV off of the name of the magazine is we didn't want to lead to it. We feel like there's a lot, because we believe there are there's two epidemics in this country of HIV, the one that's getting under control and the one that is not reaching marginalized, or that is still raging among marginalized communities who don't have access. We felt like people who were more stigmatized were less likely to pick up a magazine where the name was HIV. The people who are less stigmatized, they're able to pick up the magazine already.
Think of HIV, you think of male, you think men. And I understand that among women aged 15 to 24 is twice as prevalent as men in the same age, right? Why?
Well, that's actually among heterosexual women, absolutely.
Why?
It is, again, because of the different cultural and ethnic groups those are particularly among Latino and African American women. The highest rates are among African American women. And really, when we talk about women, we should be talking both about African American women and in particular about transgender women. Transgender women are 49 times more likely than the general population to be HIV positive.
Do we know why?
Well, we do actually, especially trans women of color. 56% of black trans women are HIV positive. And the reason why is because of lack of access to care, institutionalized transphobia and homophobia that keeps them out of unemployment. So many have had to resort to survival sex for money or for housing. Some had used all their money to pay for transition-related care, and so they don't have money for treatment. And then there's a lot of stuff about, again, discrimination and racism that really keeps those people disconnected from care.
Is there any demographic group free of HIV?
No.
No.
I don't think so.
Is there any with a very low incident?
Yes.
What group?
In our country, Asian Americans, especially heterosexual Asian Americans.
Low incidence of HIV.
Would
Do
you
we
say
know?
The doctor's better expert than me, but I'm just going to chime up because I'm loud.
Yeah, I mean, I think this approach of putting labels on people by what they look like or what their background is. I mean, HIV is a disease that's acquired by sex and using intravenous drugs, injecting drugs, those behaviors. It's not related to, what you're.
Yeah.
Christian?
It often relates to the amount of disease that are seen in social networks and sexual networks. So the more prevalence or the more HIV you see in these sexual networks, the greater the transmission.
And let's actually talk about that really quick, because African American gay and bi men have 1 in 6 black man who is gay or bisexual will have HIV by the time they're 40. That's the recent statistic, right? But the deal is, it's not because they're having more sex, it's because, and it's not because they're not using condoms. They use condoms more than white men, right. And they actually use fewer recreational drugs than white men.
Right.
So we know they don't use meth, they don't use poppers, these things at the same rates. But what we do know is that their sexual network is much smaller. So if you're a white gay man in this country, for example, it's going to take you, you're going to actually have about 8 partners before you encounter somebody who's HIV positive. If you're African American and a gay man in this country, basically between 3 and 4 partners, you encounter somebody who's HIV positive.
Do we know why the person who has HIV and gets AIDS, do we know why they get AIDS?
I'll pump this to the doctor.
So what does that mean? It means that if you have the virus in your body and it's attacked your immune system to a level where your immune system doesn't work anymore, you get AIDS. And AIDS is a number of different types of complications that are from a poorly acting immune system.
Is AIDS still a death sentence?
Not necessarily, no. I mean, people can show up with AIDS and be effectively treated.
Really?
Yes,
As opposed
absolutely.
to some years ago when it was a death sentence.
Right, before we had effective treatment. But someone who unfortunately doesn't know their status and waits until they get sick, shows up in the hospital with an AIDS-related infection, like an AIDS-related pneumonia, can be treated for that pneumonia and get on life-saving therapy.
But as we began people don't talk about it anymore.
No.
No.
Well, what's interesting, too, is with AIDS, there's a lot of talk among both clinicians and experts about actually changing that word AIDS to HIV-3. There's a lot of talk because basically it's stages of HIV. You know, nobody.
Yeah, I mean, it is. It's really a continuum, and I think now, you know, so much of our focus is getting everyone tested and on treatment and preventing people from advancing to that level.
What is PrEP?
Pre-exposure prophylaxis, and this is medications that people can take daily. It's Truvada, and essentially it would prevent somebody from becoming infected with HIV.
So who should take it?
So there are guidelines that are put out by the CDC. At our center, we have a research study and people on PrEP in primary care. We have about 300 on primary care, and in our research program, we have about 250. And essentially what we tell people is anybody at increased risk for HIV, if they want to get on PrEP and can adhere to PrEP, then we recommend doing it.
You take it every day?
You take it every day, at least the way it's currently prescribed. There's research right now that may look at the dosing changes, but right now that's exactly how
Is it popular?
Is it popular? It's effective, it's popular, its growth in sort of acceptability is growing, and it's an important part of our toolbox against preventing HIV.
We're seeing more and more demand for it. You know, a couple of years ago we had very few people on PrEP. Now, as I said, in our primary care we have 300. The requests keep coming in significantly. The challenge we see with PrEP is often associated with out-of-pocket costs. So depending on what system you're in and what your insurance is, then you could have pretty high costs associated with it. Now, in California, if you happen to be in Medicaid, then you're in pretty good shape because it'll cover the costs.
Jake, you find that gay men are less worried? The atmosphere is, well, they're curing it. Well, it's not 10% is worried about it. Do they take more risks? Why would they?
Well, I think
they took more risks.
Some of the controversy around the discussion of something like PrEP was, would that be a result? Would people feel that they would become more sexually promiscuous or higher sexual activity? But I think that through studies and what we found, that's not the case at all. And I think it's reflective as well as the morning after pill, and you know, there's opportunity here to arm people with
birth control.
Birth control.
It's like we're having the same arguments about PrEP that we had with birth control in 1962.
Completely.
So it's like.
And these are tools that will stop the transmission of this virus, that will keep people healthy. And I think obviously a very big portion of this is knowing your status and getting tested. And in relationships, having an open communication, an open dialogue, and an honest dialogue about that provides safety for both partners.
And imagine if we could get people, if we had people who weren't positive on PrEP, but who were dating dating people in high-risk populations, and then if we had people who are HIV positive, who are on treatment and able to get their cells undetectable, their viral load undetectable, meaning they can't. There's a very slim chance that they can transmit HIV. Between those two things, that's how cities like San Francisco are trying to get to the 90-90-90 proposition, where 90% of the people there know their HIV status, 90% of those who don't know their status are on treatment, and then 90% of those can't pass HIV to other people.
Were you going to say something, Chris?
Yeah, I was just going to say, you know, I think another benefit of PrEP is when you're on it, you need to come in to see your provider, your physician, every 3 months. And with that, so you're having an encounter with your provider, and they're also doing other testing particularly for sexually transmitted infections. So we're finding and treating a lot more STIs because of PrEP.
Ending the AIDS epidemic worldwide by 2030. Is that possible? We'll discuss the United Nations goal and take a look at how the U.S. compares to the rest of the world in the fight against AIDS in our final segment. Don't go away. The UN aims to end the worldwide AIDS epidemic by 2030. Feasible?
I think it's feasible. I think we have the tools at our disposal, and we have the mechanism of doing it. We just need the political will to make it happen.
How do we stack up against the rest of the world?
I mean, it's like I think the conversation has been very much give and take. I mean, as far as the statistics show, you know, it's the U.S. is doing very well.
Where do we rank in the world with HIV?
As far as rankings.
Well, I mean, the epidemic is really centered in sub-Saharan Africa in terms of the number and the magnitude. I think in retrospect, if you look back, what we've done with the tools that we have at our disposal here, you know, we could be doing a lot better. We should. There's no reason why everyone in the U.S. with HIV shouldn't be tested and on treatment.
Is there any country with little incidence?
There are some parts of the world where the incidence is very low.
And how do you account for that?
There are lower incidences in some European countries that are more aggressive about
But
you know.
one thing I would say in this country that we've got going for us is we've had a program since the early 1990s called the Ryan White Program. And Ryan White was created, named after a young hemophiliac from Indiana who passed away from HIV. And the legislation has existed since the early 90s, and it's made a huge difference for people living with HIV. So people that didn't fit into other systems, if they couldn't qualify for Medicaid or Medicare or private insurance, the Ryan White system has been able to take them and get them on meds and keep them on meds. There is a challenge, I think, for individuals who have comorbidities and other factors such as mental health and substance abuse, but in general, it's served a tremendous amount of people, and the legislation really needs to continue to happen, even since we have the Affordable Care Act, because the Ryan White program can help keep people in care.
Countries that have criminalized gay sex, do they have less incidence?
No. Absolutely not.
In other words, it don't.
Criminalization actually raises incidence. Yeah, that's bottom line.
Jake, according to the UN AIDS, 600 children worldwide become infected with HIV every day.
Yeah, it's unacceptable. If you look at the work that not only the Elizabeth Glaser Pediatric AIDS Foundation, but a lot of our partner organizations and the countries that we work with around the world, and mostly being Africa and India. If you look at the comparison between the U.S. and Africa, I mean, U.S. we've had a 98% decline in infection rate between mother to child. Worldwide, that infection rate has gone down 58%. This is something, again, that we have the science and we absolutely know how to stop the transmission from mother to child. So there's no reason why we can't get that to zero globally.
Did you have a period of time where you were bitter?
Of course. Yeah, there's survivor guilt that goes into this life, and there's a lot of resentment at times. But it's, I think, an important message for people to understand is we can either be afraid of something like HIV, or we can actually be empowered by it. This is something that is showing people how to behave properly, how to engage in their social communities in healthy ways. And we should not be holding HIV on a separate pedestal from other sexually transmitted diseases. As a community, we have to be talking about this in a way that lets go of that stigma and shows people that there's no shame, or you shouldn't have fear in taking care of yourself, knowing your status, receiving treatment.
Optimistic or pessimistic about the future of this?
Optimistic.
Optimistic.
I would agree, optimistic.
Absolutely optimistic.
Absolutely optimistic.
Absolutely optimistic.
This has been we're out of time. This has been a very important show, and I want to thank my guests, Jake Glaser, Dr. Judith Currier, Christopher Brown, Diane Anderson Menschell, and Cheryl Lee Ralph for their expertise and openness. The Elizabeth Glaser Pediatric AIDS Foundation's 26th annual fundraiser, called The Time for Heroes, is in LA October 25th. Visit pedaids.org for more information. That's pedaids.org for more information. And go get tested. We'll see you next time.